everyone. I'm Maggie McGrath, senior editor at Forbes. Over the course of 2025, thousands of NIH grants have been cut by the Trump administration. The effect has resulted in roughly 1 in 30 clinical trials being disrupted. Tens of thousands of participants, patients who need this research, have been affected. Joining us now is Michellene Davis. She is the president and CEO of the National Medical Fellowships. Michellene, thank you so much for joining us.
Thank you for having me.
So we're talking at the end of a year that's been tumultuous, I think is a good word to use when it comes to medical research. But before we dive into the exact number of grants, the total dollar figure, can you talk about your organization and what, as CEO of NMF, you oversee and the seat that you occupy within this field?
Thank you so much for that. National Medical Fellowships is actually entering its 80th year of existence. NMF essentially envisions a future where everyone, regardless of their zip code or their income or their circumstance, has access to excellent, affordable healthcare delivered by professionals who truly understand the communities that they serve. We focus really on strengthening the healthcare workforce by reducing barriers to medical and behavioral health education, as well as really working to support healthcare professionals through scholarships, structured mentorship, experiential learning, professional development, and of course, clinical research training. In our 80 years, we have given out over $50 million in scholarships to ensure that those from the communities who suffer oftentimes the most significant health injury actually have an opportunity to come back as an aspect of that cure.
Now, when we talk about what's happened for medical research and medical care, there's kind of two buckets. There's where we stood at the beginning of this year as it relates to NIH funding for clinical trials for very common diseases. And then there's also where we stand at the end of 2025 and the grants that have been awarded or have not yet been awarded for 2026. I want to start with the grants that have been cut because the year began. Patients were in clinical trials, and according to medical journal reporting, NIH grant terminations disrupted 3.5% of active clinical trials. That's roughly 1 in 30 trials. Tens of thousands of patients have been affected. How do these numbers, as reported by some of the top medical journals in the country, reflect your experience at the head of NMF?
They mirror them perfectly. And let me say this. What is really key about what you just asked is the fact that these trials were actually active, right? And so where were they active? They were active across incredibly major disease areas. We're talking about cancer, infectious disease, cardiovascular disease, mental health, reproductive health. None of these were isolated in just one particular space. Instead, when we talk about this, we have to really also focus on that patient experience that you just mentioned. So these are individuals who were actively engaged in oftentimes that one last hopeful endeavor of being able to beat cancer, of being able to survive cardiovascular disease. And that is where they were cut, right? So I do want to make certain that we mention that real and distinct aspect. I am seeing it in real time. I am seeing it in the fact that so many of our graduates of our doctors in clinical trial research program who were either just on the verge of launching their clinical research opportunity from within their own practice, which is right there in community, thereby removing the barrier of transportation and access to clinical trial participation, having to both stand it up and then immediately pause it. And then I've seen it in reference to physicians who were in the midst of it, in the midst of actively treating patients in late stage clinical trial that are already deemed safe, having to then have to turn around to those patients to say, we have to close this out. This has been truly detrimental, not just to the physicality of that patient, but also to the spirit of the hope of both the physician and the patient in the trial.
And hope is hard to measure, but I've seen it in family members myself who they've received a diagnosis and I have to believe that having a positive attitude, having hope, having physicians that have hope have helped them through that diagnosis and to a better outcome. Now, according to Grant Witness, a nonprofit that's tracking all of the canceled grants across all of science, not just medical ones, though we're talking about medical grants today, about 5,800 grants have been disrupted, some 2,500 have been reinstated. Michellene, have any of these reinstated grants helped some of the patients that you referenced, or have there been private donors who've stepped in, or by and large have the active clinical trials that have been disrupted this year, they're done? There's been no follow through. There's been no 3 months later we're picking it back up. It's done.
So I have to be candid. I have not seen the fact that the reinstatement has been able to catch up with what was missed as a result, right? Because the interesting aspect about disease is the fact that, right, it continues to progress when in fact it is not immediately interrupted. And so what say we to the patients who have the caveat of the distance in their treatment, right? From the start to the disruption to an attempt to reinstate. And so I have not seen that as of yet happen. I hope that there are others who you will speak to who will be able to tell you that it has helped to reinvigorate the research, has helped to reinvigorate the hope within the patient, and is actually showing a positive outcome. But your question to me is whether or not I have seen it, and my friend, I have not.
Now, the Trump administration had said that the cuts to the government over the course of the first and second quarter of the year broadly were to reduce inefficient spending, to cut waste, to cut fraud. In your experience, was there waste and fraud and abuse within the NIH grants awarded to these clinical trials that were in active progress?
I am not certain that I'm the best person to speak to that because I don't have as wide a scope. I have to see all of that in particular. And so perhaps one of your other guests will be able to speak to that directly. But I will tell you that if you ask a patient whether or not there was, the only thing that that patient experienced and that physician experienced that was treating them in that clinical trial was the opportunity for clinical breakthrough that they might see another birthday.
Now, I just want to go back to something you said about the scope of these cuts. You mentioned cancer, cardiovascular disease, reproductive health conditions. Is there any area of public health, of a person's body that was not affected by these cuts this year?
Because of the fact that it's such a good question, but because of the fact that we tend to look at us as we actually present within the universe, right? As we present within the world, and that is in a holistic aspect of being a patient. And so, if in fact I have an issue with cancer in one part of my body, it is actually my entire existence that is indeed affected. I'll make it as fundamentally and foundational understanding as when you bump your toe, you feel it everywhere else, right? I say that to say that it is something that affects the entirety of a person. Right. And so whether or not it is cancer or whether or not it is an issue that affects reproductive health, it is still affecting the entirety of the person. If we look at the cuts that happened in and around suicide prevention and mental health, if you are not well, right, and have and have the experience of well-being and mental health, it affects everything about your existence. And so to answer your question, I can't possibly see how I can actually cause a dividing line between whether or not there's any aspect of the physicality of a person that was not touched by this. Because if in fact you have ever lived through a bad health occurrence, I'm certain that you will agree that it affects your entire existence.
You are correct, and perhaps I misstated the question. I guess when I look at buckets of conditions, you talked about oncology, mental health, reproductive health, huge areas of medical research. Is there any area of medical research, of healthcare research, that was untouched by these cuts this year?
So I can't immediately think of any because when I think of them, I think about the ones that were impacted, like HIV and AIDS research, right? The fact that there were tens of millions of dollars that were cut from programs at dozens of universities across the country, with half of those focusing on Black and Latino populations who are disproportionately affected by HIV. If I think about the maternal health cuts, right? I'm thinking about a particular project that was set forth to train providers for at-risk mothers, particularly women of color who are faced cancellation as homicide is a leading cause of death during pregnancy at this group. If I look at sickle cell disease, right? And so as we're looking at this, it is difficult to imagine which aspect was not harmed as a result of the cuts.
One of the figures associated with these cuts is about $1.8 billion. It's the total dollar value in the cuts. How do you frame it in your mind? Is it the dollar value? Is it the number of clinical trials disrupted? Is it the number of patients affected? If you were to boil this down to one number, and I recognize it's hard to boil down to one number, but is there one that stands out as the most emblematic of what happened this year?
So when I look at that, I happen to think about the $1.8 billion as literally being around 1.8 billion dreams. Let me tell you why I'm saying that. I'm saying that because of the countless number of physicians who were pursuing this path of clinical research in order to better not just treat patients in the instant case, but to hopefully cure disease, right? And so when we think about that, I cannot help but think about the long-term effect of what we are seeing right now. You know, this land used to be a place where the best and brightest from across the globe would come because of where America stood on clinical research. Now we are seeing individuals oftentimes leave the country to chase additional funding dollars in Canada and the UK because it has been their life's work. So when I look at that, I look at all of those who would have been in the communities that had been previously served, no longer having that opportunity to hear or to tell a bedtime story. I look at all of the individuals who, again, will not see another birthday, not just those who were in the clinical trial, but those who would have withstood the opportunity to benefit from the elimination of the disease.
You lead into my next question, which is we have reporting in Forbes about the grants that were awarded in 2025. The NIH awarded 22% fewer grants over the course of this year, and there was specifically a 24% drop in cancer research. So to be clear, this is not the trials that were interrupted and ended mid-trial earlier this year. These are newer grants. There are fewer of them. How does that compound, in your view, the effect of the cuts earlier this year? We had cuts and now we have fewer grants. What does that mean for 5, 10, 20 years from now?
So one of the things that the research evidences for us around what keeps a professional in the space of clinical research has a great deal to do with mentorship, has a great deal to do with additional supports. Well, when I look at the fewer number of grants that are even being funded now, I cannot help but also look at what that means for the professional, right? So what does that mean for the clinical researcher? What does that mean for the medical researcher? And oftentimes I am faced with the fact that in looking at that we're talking about incredible volatility, we're talking about projected instability, right? And so it is highly likely that after already seeing studies that report the fact that there are upwards of 700,000 individuals in healthcare that are either looking to leave their job or looking to leave the healthcare industry as a whole, that here we have a disincentive for individuals to go into the field. So when I look at that, I look at the closing of an area that we need only the more of, and the lack of the ability to forward progress clinicians into clinical research.
I just want to emphasize that figure that you just said. 700,000 healthcare professionals are looking to either leave their job or leave their field entirely. We are facing in many parts of the country physician shortages, physician burnout. How badly if all of those individuals were to leave their jobs, how badly would that affect the current state of healthcare services, healthcare delivery in the United States?
Well, this is exactly what National Medical Fellowships is actually targeting, right? We're trying to address the physician shortage. We're trying to address it at a time when we are seeing incredible numbers around physician burnout. Why are individuals burning out? Is because the crisis is already upon us. It is not coming. And now we have greater disincentive in order to go in and stay in a career which is already incredibly demanding, but also, right, incredibly understaffed. And so what we will see are large swaths of the country becoming uh, medical deserts. We will see particular elements in hospitals and physician offices literally shutter. We're talking about the elimination of healthcare access, not just as we see it right now, largely in rural swaths of the country, but just about everywhere. I cannot be more poignant about what this does and how this infects not just the future, but even who will treat you today, who will treat the people that you love today, and then who will treat us if we are lucky enough to have that many birthdays, right? Because of the fact that we are seeing the numbers of those interested in even going into the career go down, while we are seeing the numbers of those who are seeking early retirement go up.
Now, when you talk about going into the career, are you talking about physicians as a whole, or are you talking about physician researchers, folks who spend time in lab but also time with patients, or is it all of the above?
I am talking about all of the above, generally. What have we seen as a result of the recent Supreme Court decision around affirmative action, at least on the med school level, right? What we saw was literally a double dip in applications from Black and Brown students. Well, here's the rub. No matter how people feel about DEI, the issue is that unless we are making it possible for everyone who has the talent, the ability, and the desire to actually achieve a medical education, then every aspect of every specialty, every aspect of clinical research, every aspect of curing disease that happens along that path has already begun to be shuttered because of the fact that the pipeline is literally being choked out.
The pipeline is already being shut down. I wonder, we're speaking at the end of what has been 1 year. I think it has felt like a long year for those in your field, if I may project. How possible is it to undo the damage? In other words, is what happened this year irreversible? Could we come back from this?
So I will be candid with you, well hopeful, that much of what we have seen in this year alone shall have the impact that will be felt for decades to come. We've already heard from medical students and residents who were slated to work on NIH funded clinical trials, and often it's their first exposure to research, that have had those opportunities disappear midstream, already begin talking about pursuing other avenues in their career, right? So we have already seen that these scholars that bring to this, yes, the right amount of medical education, but also the lived experience that makes their research that much more pivotal to the space, that they're already beginning to wonder whether or not this is a space for them. These are the exact individuals that we need to come into community-based research, academic medicine, and leadership roles in public health, right? So will we be able to turn this around? If in fact we understand that it will need to be a long-range plan, that we need to fully embrace that the harm is significant, it is quick, and it will be long lasting. But as a result of that, the remedy has to be one in which we double down and plan for the long-term correction. It is the only way that we will be able to make it through this.
So, with that in mind, what will be the 1, 2, or 3 tasks that you prioritize in 2026? What is on your to-do list for the new year? I'm sure the full list is long, but as you look to shore up areas where you can, what are the top 3?
Yeah, thank you so much for that question. I really think that one of the top priority focus areas for National Medical Fellowships as we look into 2026 has a great deal to do with providing an intentional community in support of our medical scholars and alums, one which will help them to really balance in a time of uncertainty and volatility, that also helps them to embrace long-term planning for institutions, for trainees, for clinicians. I will tell you that some of our alums who are in careers will health equity was an aspect of their roles. They have either been repurposed to other areas or lost their jobs altogether, right? The same for those who actually were in the midst of some of the clinical research opportunities. And so we are spending more time helping students and patients and physicians really navigate this instability. We're looking at making certain that we are identifying opportunities for them to engage in career transition planning, but also what will it take in order to keep them whole, mentally well, and in the profession. And so we are laser focused on that as well. We are also taking a look right now because National Medical Fellowships is also a nonprofit. And as you know, that the recent efforts of the administration have also done something in the space around nonprofits. We're also making certain that our physicians that are either scholars or alumni have an opportunity to come to us for continued medical education and others. But how do we make certain that our communities are supporting one another as they are also supporting patients in the communities that we serve? So we're really balancing between physicians that really feel caught between evidence-based care and external pressures, right? Helping them to really navigate this space so that they understand that burnout doesn't have to be their end game, right? That there's an opportunity to even overcome some of the moral distress that they feel and the navigation between vaccines and public health guidance in order to ensure that they've got some guidance around policy consistency.
Those are hopeful words to end on. Michellene Davis, President and CEO of National Medical Fellowships, thank you so much for joining us. We'll have to have you back in 2026 so you can report on the progress you're making towards those goals. But in the meantime, thank you so very much.
Thank you.